joining me today for the Coffee Chat with Kimberly. I'm here at the WCI Workers' Compensation Institute Conference in Orlando, Florida. It's actually the 69th annual education conference, and it's timely that Dr. Chris Brigham joins me today and an opportunity to talk about an amazing book that he's recently published that's really going to help us educate injured workers. So the reason I say it's timely is one of the key focuses of this conference is about education. So thanks for joining me today, Chris. You want to share a little bit about your background and why you chose, the Living Abled and Healthy book?
I'll be happy to. And first, Kimberly, thanks so much for this opportunity to have this conversation, and thanks for contributing to the book. We really want to change things. We really want to have better outcomes for those who are injured and ill. And really the premise of this was that years ago, being involved in this field now for over 3 decades, saw people with an injury go in one direction or another direction, and try to figure out why was this? Why was this person disabled and this person not? And then looking at all the complexity of the issues, it's a complex maze that we have people go through. And we started back in 1912 with workers' comp, and with good intent is to keep it a simple process. It's become extremely complicated. And so my goal was to really understand those issues. I actually started with a book called The Crippling of America, discussing the needless disabling that occurs, and an expose. That was 10 years ago. A little slow in this process. But then realized what we really needed, we needed something for those who are injured or ill. When we confront these systems, when we confront our problems, how do we move forward? And how do we involve other stakeholders?
So when you say we needed something for the ill and disabled, it sounds as though then the book is really written and designed for the injured worker?
That's the primary audience. It's all of us. When we have an injury or illness, how do we deal with that? Really, how do we define our health? How do we define our ability? In looking at those characteristics that distinguish those, of resiliency, of attitude, then how do we understand the systems? And how do we understand the providers? We have these perverse incentives that drive certain behavior in the system that often is the detriment of the individual.
So how do you, when we've got this great guide on injury and illness recovery, how do we get it in the hands of the right people? What are your plans about distribution? Is it a company like Sedgwick? Is it employers? What are your thoughts around?
Sure, good question. Well, first of all, I want to get this in the hands of every injured or ill person, every claimant, and I want to empower them so they can have joyful, productive lives. I also want to get it in the hands of the other stakeholders, of healthcare providers, attorneys, claims, and other folks, not only in workers' compensation, but in other arenas, because a little bit different sections, context of it, but it's similar type of issues. So what are my plans? My plans are primarily to have employers or insurers give this to claimants, showing their concern, their care, giving them a resource that they can read through. And they can then access the resources on the website, which are specifically for the readers, where we have agreements and we have forms and we have documents.
So let's talk about that just a minute.
Sure.
So could you share a few of the chapters that are in it that might help our audience today understand what some of the topics are? And when you say forms, is it medical, disability? Do you mind sharing a little bit about some of the chapters?
I'd be happy to. And in this process, too, let me share with you before the chapters. This was a challenging book to write. I've written the senior contributing editor for the AMA Guides, Evaluation of Permanent Impairment, 6th edition. Very technical, probably put you to sleep reading it, but I needed something, interesting and shorter, so I engaged a co-writer who a lot of experience in the publishing area, so we could really keep this engaging. So what do? We start with an introduction, of course, and then talk about the whole issue of health and work, and why work is really important to who we are, and how do we take control of our health, from the standpoint of the mind, the body, and the spirit, getting into discussions of some of the common terms, because it's like being in a different country. We have different language. You need to understand that.
It is a complex maze, as you said.
Yeah, so. It is, and what hurts us? We so often experience problems in our lives that are just part of everyday life, but somehow they get in the system and they get, you've got back pain, or you have this problem, or you have a sleep disorder, you need to be treated. So get some insights to that.
And let me just stop you for a moment?
Sure.
As I'm listening to this, and I think for those of us here at the conference, and certainly in the industry, in our offices, we work really hard to be able to connect with the injured worker and help them understand this maze and the complexity. Is the book written at a level of understanding and that it's very technical, or would an injured worker be able to pick this up and say, wow, I understand workers' compensation and what my claims process is, and the resources much better?
It's written at approximately 10th grade level.
Okay.
And that was a major challenge, especially for me to do that. And so we wrote it in a level that should be understandable. We use the term we because rather than I or you, we're all involved with that. So we use the we engage that. We have lots of stories, and then we have great contributors that have expertise in certain areas. So when we're talking in other chapters on attorneys, when do you involve an attorney and when do you not? Because there are some downsides of that. Because what do we reward in terms of behavior of the attorneys? More injured, more ill, more disabled, more money you get. And that's not the right thing for the injured worker.
So the injured worker will learn about their disability payments, the return to work process, claims examiners,
yeah, the
nurses,
great section on claims adjustment, how to relate to the claims adjuster, which you wrote.
Well, thank you very much for the opportunity. I think for right now with health reform and the fact that we really need all of us as consumers to be more engaged in our health care and the claims process and selecting health insurance, I think your book's very timely. And for those of us in the industry to really think about advocacy, and this book is a form of advocacy.
Absolutely.
It really is a great timing. We also, I think, from a business perspective, if we want payers and employers to get this in the hands of injured workers, we may be asked about ROI. Do you have any ideas or thoughts around, if that conversation comes up, how to address ROI?
Yeah, absolutely, because we're going to look at that return on that investment and how do we reduce costs, both the financial and human costs. And what's been interesting with this is it's a different approach. This is a inexpensive book. It's under $25, and then in terms of large volume, substantial discounts available both in printed and electronic format. So let's take the math would be simpler if I just used the $25 level, although it would be less. So you buy 1,000 books. You have one claim out of the 1,000 that doesn't become that $100,000 claim. That the average comp claim is $50,000. So you avoid one going to $100,000. You got a 2-to-1 ROI on one out of 1,000. So what we hope for is it's going to be like 1 out of 20. So I think there's a tremendous opportunity, and you're doing what's right.
And I would say I'm not opposed to the conversation of ROI, and I believe it's important that we always consider that. I also would challenge our audience and ourselves, our own companies, to really think about ROI from an educational perspective. That if we can get off from a claims perspective on the right foot in the beginning, quality providers, mutual understanding, and communication, that the benefits for all of us will really be forthcoming. So how would someone get further information on the book now that we've talked about what the book is and why everybody should be interested?
How to get further information is go to the website. It's livingabled.com, or you can get further information at livingabled.com/info. Also get information on the forms that we have and the agreements in terms of patient-doctor agreements, what each commits to do in the relationship to get the best outcomes, and all sorts of other forms that can be used to monitor progress, to monitor outcomes. Those are all available on the website to the readers. So go to livingabled.com or email sales@livingabled.com.
All right. Well, thanks again. We're so fortunate to have Dr. Christopher Brigham with us today, internationally renowned occupational health specialist. And again, thank you for your contributions to the industry, and we'll look for the book.
Kimberly, thank you so much.